Welcome to Channel 17, the Town of Colonie Government Channel.
Hi, I'm Dr. Amy Earshen, and this is Inside Addiction.
So, Dr. Earshen, tell us a little bit about yourself and your background.
Well, Dean, I've got a small psychiatric practice that I've been running for 5 years in Clifton Park, right off exit 10. It's a very small practice. It was always my dream to have my own practice, and it's been quite an adventure over the last several years. I've enjoyed it.
What got you interested in working with recovering addicts and in helping addicted people improve their quality of life and enter a life of recovery?
Prevalence of need in the community, primarily. There is a huge epidemic of people who are suffering from addictive disorders, especially among the younger people, with lots of fatal consequences. Unfortunately, the opiate addiction is quite unfortunately prevalent in our community. There's a need, and I became aware of that need just on the basis of people calling my small practice and asking for help with that.
And what exactly is a holistic approach towards addiction treatment and recovery?
Just exactly what it sounds like, a whole health approach to the person who is suffering, meaning dealing not only with physical and the medical aspect of that person's life, but also spiritual, emotional, relational, occupational, the whole picture of what goes into making that person's life either stressful or something that's supportive of their recovery and their health.
And what are some of the differences between a traditional versus a non-traditional approach to addiction treatment that your practice offers? What's the difference between a traditional as opposed to non-traditional treatment?
Well, first I'd like to say that we employ both traditional and non-traditional modalities, traditional being medication management and traditional forms of counseling and psychotherapy. And those are directed at symptom management, immediate relief from symptoms. And non-traditional approaches take a more holistic and a broader view of the individual's life. Things like yoga, meditation, relaxation strategies, acupuncture, which has been great, lots of different other approaches that are aimed at different ways of helping people to envision their lives from a positive, healthy point of view, and then think about how they can put together a life that's going to support their recovery.
So you offer several different unique services, such as not only individual but family and group therapy. Tell us a little bit about each of the three, starting with individual therapy, then going into the family and group therapy that's available through your practice.
Individual therapy is, of course, geared toward helping an individual in a one-to-one setting deal with a therapist about their individual issues and nobody else's. So it's a very intimate one-to-one. However, that approach to individual therapy can be quite varied. We have a social worker who is also a yoga teacher who utilizes many of the philosophies of yoga and the experiential exposure to yoga to help people find their center and learn how to be in their body. People who are addicted have spent a lot of time and money getting out of their body, out of their normal state of consciousness, and to have specific assistance in becoming comfortable in their own body again is a huge part of that individual mode of counseling and therapy, both talk therapy and yoga. There are other approaches and other individual slants to individual therapy that we have in our practice. So we have we're interested in peer counseling, which is really who better to help addicts than somebody who's been through the process and is in recovery themselves to help other people branch out into the community, create a support network, and so that's a newer idea on the addiction front that we're very interested in. And so we do employ people who are recovery coaches.
How about family therapy sessions?
We think that the family is a very important part of a person's recovery, and the family should be involved. A person doesn't recover in isolation, and the family needs to be educated and help to understand how they can help, and also how they themselves have been affected by the person's illness. So we find periodically having family meetings are really advance and move forward the recovery quite a bit. It's an important part.
And finally, the group therapy and the therapeutic value of group therapy.
Right.
Tell us a little bit about that and the experience that you've had at your practice.
Actually, I would say the group therapy is maybe one of the pieces that surprised me as really kind of cracking open a person in isolation. Addiction is a disease of isolation, and people, I've had people tremendously resistant in my practice to agreeing to join a group that we're running at the practice, no matter how small it is. And my groups are often 4 or 5 people and not much more than that. But had people have kind of amazing breakthroughs, realizing that how stigmatized they actually felt, and being in a room full of people who are people that they respect and can relate to, seems to cut out that stigma, and which is a huge part of what blocks people from recovery oftentimes. And the isolation. I think being able to feel how good it feels to connect with people and feel that connection is a huge step.
Now, you mentioned yoga, and what got you interested in implementing yoga into an addiction therapy, and what kind of results have you seen bringing yoga into your practice and working with the addicted population?
Actually, I had an experience in yoga after I had a riding accident and fell off a horse. Had a pretty significant back injury that after months really just wasn't healing, and I saw a yoga therapist, a brand of therapy called Swarupa Yoga, which focuses on the spine, the lower back, and if you know anything about yoga or chakra therapy, the lower part of the spine is associated with security, groundedness. It all kind of makes sense in a way. It's called the root chakra area. And after doing work with this particular yoga therapist, Pepper Wolf, who is also a master social worker, the two of us were talking, and as we would have the sessions, talking about how this would apply incredibly to the addicted population. I can't remember, but it's like the two of us just almost simultaneously realized that this was an incredible application. She'd been working on it as a graduate student, thoughts about how this would how appropriate it really was for addicted persons. So it was a personal experience, and then we actually, Pepper started teaching some groups with me in my practice for addicted people, and it surprised me how accepting people were of doing yoga in class. We moved all the furniture out of the room, our small waiting room, and people took to it immediately and found that it was something about just being able to sit back and relax and being encouraged to settle into their own body and to try less hard. I think a lot of times people are saying to addicts, try harder, you've got to try harder. And that's sort of a maxim of our culture. Push harder, try harder, do more, rest less. And something about these stressed out people, when someone actually says, sit back, relax, take a breath, do more by doing less, accomplish more by doing less.
You also mentioned the benefit that you've seen from kind of like the peer-to-peer recovery coaching. Could you touch briefly on how that's been in your practice and the response you've gotten from people that have participated in meeting with a recovery coach?
I think there's nothing like people who are struggling with a specific problem, talking face-to-face with someone who has that problem and has mastered it, has made headway. There's just nothing like it. And my dream is actually ultimately that in the end, when people have done well, maybe after a year of sobriety, may become alumni of the program and actually become counselors themselves on this peer coaching basis. We can train them.
Now, your practice also includes a level of medication management for the person entering the recovery process. Can you touch a little bit on the medication management aspect of your practice and how it kind of complements the other services, including like yoga, recovery coaching, the individual and group therapy? Mm-hmm. How does medication come into play?
Well, as you might think, as a general adult psychiatrist, I am meeting a lot of my clients because they are suffering from depression, bipolar disorder, anxiety, a number of things. And the medications have to do with a specific diagnosis that person has. A lot of times an addiction will emerge that I was unaware of, and it's very common for people to try to self-medicate with a psychiatric illness with recreational substances. And we have found that there are medications that are very, very helpful, especially with the opiate addiction. Suboxone or buprenorphine is a partial mu opioid agonist, which is an excellent way to detox people from street opiates and control symptoms. It's not a high for people, however, it does control the cravings and withdrawal symptoms pretty effectively and give people a margin of time to work on preparing to release opiates as a way of coping in their lives, to create a fuller life and a foundation where they can let go.
Now, tell me a little bit more about Suboxone, and I know some of the stigmas attached to it, like how Suboxone works and why the use of Suboxone in your practice isn't replacing one drug with another, and the immediate benefits of an opiate addict that hasn't been able to stay sober,
right,
getting on Suboxone.
Well, first of all, your brain Suboxone is a long-acting opioid agonist. And what that means is a partial agonist is that it's stimulating the opiate receptors in the brain instead of like a short, intense burst, like, let's say, like a love affair. It's more like a long, enduring, duller, but reliable friendship. It's always on the receptor, it's calming, there aren't the highs and lows of being on a narcotic, a street narcotic. So it's much better for the brain, number one. People begin to stabilize almost immediately. It also gives people, because there isn't the euphoric rush, and yet there is not the punishment of withdrawal, people remember instantly what it was like to be well and not to be suffering the lifestyle of an addicted person. So it's almost like a fast forward, and it's a hope producer. People are able to function and have normal lives, go to work, sleep, begin to eat normally again, begin to relate to people in a more normal way, in every way. Again, it's not the answer. It's a medication. It's a temporary support. This is how I view it anyway, and this is controversial, although I view it as a temporary support while a person is doing all the other work they need to do to put together a life that is working for them, that actually supports their sobriety. In other words, they've got relationships that are working in their lives, and healthy relationships. They've got an occupation that they're happy with. They're pursuing educational goals. They're back on track. They're going somewhere.
What is some of the success and improvements that you've seen with some of the people that you've worked with that have been on Suboxone? Have you been able to see the difference in progress in that? And how soon were you able, and were they able, and did they report feeling better or a difference and improved quality of life?
I think there's an immediate improved quality of life that people experience. As far as the how long it is before someone is better, it's a varied question. With some rarer people who, it's not very common for people in the early phases of an addiction to get help quickly, but those people often can quickly recover and do quite well. There are more commonly people, when they reach the point where they're desperate enough in their addiction to come for help, are sicker and have broken down in a number of ways more, and it takes longer to help them put their life together. However, I mean, there are incredible stories of people who I've treated I've had a couple of medical students who have been trapped in an opiate addiction, heroin addiction, or other opiate forms, even oral ones can be pretty intense too, whose lives were derailed, who got their self-esteem back, believed in themselves, began to open up again socially, and create a way back onto their medical career path.
Now you bring up a couple medical students that you've worked with, and can we talk briefly about some of the people that you've worked with in different professions? Because I think a lot of times what prevents people from seeking treatment, we know that 23 million Americans suffer with addiction, yet less than 10% seek and receive treatment. And I think a big part of that is the stigma, not necessarily that the treatment's not available, because obviously it is. What are some of the professions of people that you've worked with beyond even the medical student? Because opiate addiction isn't restricted to the stereotyped junkie with a needle sticking out of their arm.
No, absolutely not. For whatever reason, my practice seems to have attracted mostly younger people. We certainly don't treat only exclusively younger people. So I would say that a lot of the people are, young, either college-age people, but also a number of them are people working for the state and six-figure income jobs. I don't think I've treated anyone in the legal profession for opiate addiction. As I said, medical upcoming, certainly.
One of the benefits that I know you've told me about your practice is the confidentiality, the private setting. So tell me a little bit about, and we're going to show some pictures actually of some of the office space and some of the meeting rooms. Good. So tell me what you believe makes your practice different, and what are some of the benefits that if you were someone seeking the services that you yourself provide, why would someone call Dr. Earshen?
Well, it's small, and we like it that way. It's a very small private practice. It is off the grid. It's not a high volume, high pressure. Because we keep our numbers low, there's a sense of, I think, privacy in going there. It is quite a private setting. We work hard to keep it comfortable and very non-institutional, but all of these things, because it is a small physical setting, it really limits us in terms of numbers, but that, I think, turns out to make what we're doing a lot more effective. I think the small size and keeping it that way it's a goal of ours. We don't really want to explode our numbers at all. I think we'd lose a lot of what we can do because of the privacy.
Now, how could someone get in touch with you, and what hours are you available? Do you currently have openings? If someone were interested in contacting you, how would someone get a hold of you? And you mentioned some professionals that you've worked with as clients. A lot of people have the 9-to-5 job. They don't want to take the time off of work because they don't want their employer to know that they're going to a doctor's appointment. So tell me a little bit about also some of the benefits of being in a private practice, confidential, and some of the unique hours that you offer for services to meet people's special needs.
We do, of course, have evening hours. It's almost a necessity to do that. Our groups and individual sessions can be and are often held in the evening, and are often also scheduled on the weekends, which does help people with the confidential aspect and preserving family time and a normal routine.
Any final thoughts you would have for perhaps someone watching the interview? It could be a family member, it could be someone struggling themselves firsthand with an opiate addiction. Maybe somebody's questioning, well, maybe I'm not as bad as so-and-so, or I can't be an addict because I have a prescription for hydrocodone. So what advice and what words would you give to someone watching, either that may be questioning their own possible addiction and need for treatment with services like yourself, or perhaps someone that's watching and saying, hey, maybe my son, maybe my daughter, my mother, father, brother, sister could benefit from this service?
You're touching on it's such a sensitive topic, and I think denial is such a huge part of addiction. I guess I would say is if you're wondering, if it's crossed your mind that maybe it would be hard for you to actually stop taking a prescribed medication, come for an assessment. This is not a practice where you're liable to suffer any kind of public exposure by coming here. We have no one who comes to this practice is mandated. We don't have that, and so you're not going to be in a situation of having to work with other people who are, don't want to be there. Come, let us assess you, meet us, and let's figure it out together.
And what's a phone number somebody could call to get in touch with your practice?
518-877-5050.
Thank you.
Welcome to Channel 17, the Town of Colonie Government Channel.